So Buddhism is for mental health, not for mental illness. And there's a huge distinction between those two. Now, of course, if you look at the overall where Buddhism started, and I've said this before, is that Buddhism started from depression, anxiety, and stress. That's what Siddhartha Gautama Buddha, which he became the Buddha, right? But first he was our prince, right? And he was going to be king of an entire area and have a lot of responsibilities, but he also had a lot of authority, and it's said that he could have said anything and anything goes. However, he knew that he couldn't change a few things like people dying, people getting sick, people getting old, which he really wanted to, and he wanted to figure that out. And that's why he took off and he said, I got to get this figured out. And he left and became what's called a mendicant first. He didn't become a monk. He was never a monk, really, so because that didn't show him until later. But he became a mendicant, or like a what are called pratyeka. So right, he became all by himself an ascetic, someone who just goes and practices by themselves. Now, there's a lot of pitfalls, but notice he didn't practice completely by himself in the beginning. He went to many gurus, and those gurus are the ones that like helped train him in the basis. Now, he was actually smart enough to pull the best parts of it and leave the rest. This is very, very important in any of our practices. As we develop, we get better at getting rid of things that don't really work and keeping things that do really work for us. Now, this is like Bruce Lee says, absorb what is useful, right? Leave the rest behind, because there's going to be techniques, there's going to be things that you just can't do for some reason. Now, it could just be sitting position. Maybe you have bad knees. And so what, you can't practice anymore? That doesn't make any sense. So, for mental health, as we develop in our teachings and our understanding of the processes of sila, of dharma, of dukkha, of all of these things of suffering, we have to have a good understanding of suffering. We have to have a good understanding of the causes of suffering. We have to have a good understanding that there is an ability to get out of suffering, and we have to have a good understanding of the paramitas, which are 6 of them, and then we have like the Eightfold Path, which are different things which I've talked about in other videos. You can go see. Probably I'll try and put a little video thing up there. But I've done videos on those. Look at the playlist. You can see that kind of stuff. It's all for the free Buddhist class. Or go on the website, thecenteredpath.org, and look up the downloads. And that's where I have the cheat sheet, which has all this stuff in it. If you don't understand those, you're just going to be sitting, which is fine. I mean, it's good to sit and be quiet sometimes. It's very nice, but you don't get much more out of it than this little stone statue right here. You can't be that statue. You're just not going to benefit as much as you would as if you studied, if you read, if you listen, if you contemplate, and if you search. As you search for stuff, you're going to find people who are really good and people who don't appeal to you, which is fine. I mean, if this doesn't appeal to you, find someone who does. That's the best thing to do. Likewise, if you can, like this if you like it, and subscribe if you want to see more. But for mental health, it's very good. You're going to get more healthy. You're going to get more resilient. You're going to be able to let go of things more. You're going to react to things differently. Not you're going to stop reacting. Notice I never said in there you're going to stop thinking. Your mind's going to go a million miles a minute. That's its job. The brain and the mind, the whole purpose of the nervous system is to determine self from other and good from bad. Is this good for me? Is it bad for me? Can I eat it? Will it eat me? Can I have sex with it? Or whatever. I mean, these are all the things that your nervous system actually really does. And it gives you different chemical bursts depending on that. Now, it's with training we can change this for sure. Sometimes there's chemical issues. You may need nutritional help. You may need chemical help. You may need to have an outside view, which is therapeutic help, right, of someone who can help you. Now, this is also a teacher, but think of your teacher as like a therapist as a teacher, or a teacher as a therapist sometimes. Now, having a good therapist is a very, very good thing to do. Having a good friends, we call them Dharma friends, are a very, very good thing to do. If you have mental illness, get the illness addressed first. It could be a chemical issue. It could be an organic issue. What if you found out that you had some little benign meaning it's non-cancerous, right? It's not a bad, it's not good. But benign means it's not going to kill you. But you have a benign tumor that's causing your problems, and with one simple, very small little medical procedure, they could get rid of that and everything would be fine. We have to find these things out first. You can't keep trying to do something and expect a different outcome. That is the definition of insanity. And that's not what we want to do with meditation or with Buddhist practice. Chan practice, Zen practice, Mahayana, Theravada, Vajrayana, Lamaism, Hinayana, it doesn't matter. Whatever you're doing, if you're doing the same thing and you're not getting a good result, you need to tweak it. You need to learn, find out what it is. And that's through contemplation. When you contemplate and you start to understand that you are the one that is in control of what goes on in here, you can take control. You can catch it soon, right? It's a big animal. The inside the mind is a rough place to be. Don't go alone. And also, go prepared, because it's big and it's strong and it can take you for a ride. And if you allow it to take you for a ride, you're on the ride sometimes. Sometimes you can't even let go. Your hands get tangled up in that. If you can catch it soon enough, you can either jump off, you can change the direction of it, or you can calm it down. These are things that meditation in Buddhism offer you over time, not for mental illness. If you're having a psychotic or some kind of psychiatric problem, you need to get the help first. You need to get the rest, because it might be just too much going on up there. We need to calm it down. Sometimes medicines, herbs, different things like that can help us calm down in the short term. I don't like medicines for long term for anything, although there are some things we have to have lifelong. What if we have diabetes? We have to have insulin supplemented, otherwise we could die. Or certain heart medications, or certain psychiatric medications too. But we have to understand that the better we get, the healthier we get, the less we'll have to rely on those, and we can actually use less of them over time. You can do that. I assure you. I've been doing healthcare for over 25 years, or 20 years at least, almost 25 now. Over 20 years, and in that time I've seen people change their medicines. I don't care what kind they were. They've reduced their medicines, usually with cleaning up their lives and cleaning up their minds. So anyway, this is Reverend Sean over at the Center Path. Don't forget to subscribe and like. Follow other stuff that we have, which is going to be over here and here, subscribe and all that kind of stuff. And we will go over the problems of meditation, the problems with mental health and mental illness and meditation and mindfulness and MBSR and all that jazz. Reverend Sean, talk to you guys soon. You guys take care of yourselves, and I'll see you on the flip side.